So I like to put myself in the role of a consumer. What would, if I had a problem and I was seeking a sex therapist, what would I look for? What would be the criteria for me to decide between one therapist and another? And I think one of the criteria would be whether they actually develop a treatment plan rather than just saying, how do you feel, as the whole approach to therapy. It might make people feel better when they leave the office, but it's not going to solve their problem. So people who have an actual treatment plan and an approach, which I do with cognitive behavioral therapy to try to help people change their thoughts and get rid of negative, distorted thoughts in favor of rational thoughts, really helps their feelings and their behavior, including sexually. So I like to say a person should have a good personality, they should have a sense of humor, they should be easy to talk with, they should not be on a pedestal or think that they're better than the people they work with. And I think that a good sex therapist is somebody who gets to the heart of it right away. They don't string people along. They try to solve the problem as quickly as possible because that's the ethical way to proceed as a therapist. I also think that most sex therapists are pretty dry and they just kind of basically take a kind of cookie cutter approach and deal with everybody the same, whatever they read in their textbooks. Well, that's not what I do. I tailor every treatment plan to the couple I'm working with, and I look at all the criteria for their problem, and I realize that there's more than one piece to any puzzle. And so I do medical consultations, I work with doctors, I take a team approach, and I'm much more sophisticated about the medical aspects of sexual response and orgasm than most therapists. Instead of just saying, well, I'll just refer them to your doctor and they'll handle that. That's a mistake, because most doctors aren't trained in sexual medicine and they really don't know what the hell they're doing. So I refer to doctors who do know what they're doing. They're specialists in sexual medicine, and that includes endocrinologists for hormonal issues like low testosterone, gynecologists, and urologists, and I also work with general practitioners. But I find in general that specialists are the best way to solve a problem, taking the team approach. So that makes me unique. Most sex therapists just deal with the mental part. They think everything is mental. Well, it's not. The physical and the medical affect the mental, and then the relationship is affected. So we have to approach these problems like erection dysfunction or anorgasmia with women or painful intercourse from all three levels: the physical, medical, the mental, and the relationship level. And so I do that simultaneously so I can solve a problem as quickly as possible. And I give homework. Most therapists don't give homework. I give people something to read and write and work with their thoughts, and I also have them discussing what they need from each other emotionally and sexually in what I call a session at home without me. And then I talk about that in our sessions so we can improve their communication. So I am a couples counselor as well as a sex therapist, and that's the only way to comprehensively solve a given problem.